Hi, I'm Marty Cohn, and welcome to episode 4 of Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information about health-related topics. Grace Cottage Hospital is an independent healthcare facility located just 17 miles north of Brattleboro. Among its services are primary care, rehabilitation, and 24/7 emergency care. For nearly 70 years, Grace Cottage's mission is to promote wellness, relieve suffering, and restore health. Vermont Health Connect is a way to choose a health plan that fits your needs and your budget. Open enrollment for Vermont Health Connect runs from November 1st through December 15th. On this show, we will be discussing health insurance in Vermont, finding the best coverage and using it wisely. Our guests are Jane Wheeler, Resource Advocate, and Bill Monahan, a registered nurse and Community Outreach Coordinator. Both are members of Grace Cottage Hospital's community health team that offers free services to area residents. Welcome, Jane.
Hi, Marty.
Well, thanks for coming on the show. Now, right off the bat, I got to ask a question. Community Health Team Resource Advocate. Yes. What exactly do you do?
Well, I'm kind of described as the nuts and bolts type of person that's going to help people get resources that they need. The one thing that my goal is when they come into my office is to make sure that they don't go without because they don't know what resources are available or they need some help with applications. So while yes, most of my talk will be on health insurance, I do have to point out that I help with applications. We work together to do for food, fuel, housing, help with prescription costs. I help with the application for Social Security Disability or SSI, so they have some financial relief. And also I need to mention the Grace Cottage reduced fee application. Well, it's the reduced fee or free care application. I help with that process. I help with that application and I get it to the program to be reviewed. And that's certainly the tip of the iceberg. It's not a complete list, but if people just want to call and run things by me, I try to help them get the resources they need, and even that might be referring to them to other agencies. We can pick up the phone and try to track down something that might be useful to them.
Wow, you do a lot. You're a great
Yes.
resource.
Yes.
So let's talk about health insurance options. What health insurance options are there for Vermonters?
Okay, I wanted to mention too that I'm a certified application counselor for Vermont Health Connect, and that's why I'm focused in on helping people choose their best health care insurance options. But what's available to Vermonters is certainly the private insurance through an employer. That part I don't help with. They're on their own with that one. There is private insurance for Vermont Health Connect. We call those qualified health plans, and that's the Blue Cross and Blue Shield and MVP. There's a Medicaid for adults and a Dr. Dinosaur Medicaid program for those children through age 19. I believe that ends on their 20th birthday. And that is, you apply for that through Vermont Health Connect. There's also a Medicaid for the age blind and disabled, where those folks are on Medicare. So that's a different pot of money, and that's a application that you do through the Green Mountain Care programs. And of course, then there's Medicare and all the associated health insurance with that, along supplemental plans, the Part C Advantage plans, the Medicare D plans. So there's a lot for people to choose from and to figure out where they are in the process.
So I need you to help me understand one thing. You kept saying Vermont Health Connect.
Yes.
What is Vermont Health Connect?
Well, Vermont Health Connect is Vermont's health insurance marketplace, where people apply for the insurance, the qualified health plans, or Medicaid under the Federal Affordable Care Act. So the insurances that they're applying for have to follow the mandated services that all insurance companies need to offer folks. And you can apply through online, right through vermonthealthconnect.gov. You can call them and do an over-the-phone application. 855-899-9600.
Okay, great.
Yes, and there are paper applications, but that processing time can really hold things up. They can take up to 30 days to process that. Sometimes they don't, but then it's correspondence back and forth, and you have to still have to pick a health plan. Or they can come and make an appointment with me, and I have some information on that for later on. But certainly setting up an appointment with me, and we do an online application with them.
Now, I mentioned at the top of the show that there's a open enrollment period or open enrollment process. What is that open enrollment process?
Well, that's the time that you're either going to get the information to renew your qualified health plan, or you may be applying for a qualified health plan for the first time. And certainly, as you're applying, you may be found eligible for Medicaid or Dr. Dinosaur, but individuals that are eligible for Medicaid or Dr. Dinosaur can really apply anytime throughout the year. And so I just want to mention there's other special circumstances where people can apply outside of open enrollment, and those usually include things like you're having a baby, or you've moved to Vermont, or you when you've become pregnant, if you get health insurance some other way, through Medicare, through employer, or through Medicaid, to have a change of income. Those are all special circumstances where you can apply outside of open enrollment. But if you don't fall into one of those, and folks can call me for a complete list, if you don't fall into one of those or you're not eligible for Medicaid, then open enrollment is the only time during the year that you can sign up for health insurance, and it'll be for the following year.
Now, again, I always get this mixed up, but Medicaid, Medicare, what's the difference between those two things? Are they synonymous or?
No, they're not.
They're not synonymous. Okay.
Absolutely
All right. So
not.
what's the difference?
Well, Medicare is through the federal government, and that's people that are 65 that's their time to go on Medicare. And actually, too, people that have been on disability, SSDI, for 2 years, after 2 years, they transition to the Medicare program, which is federal. Medicaid is governed by the state. That's a kind of a combination state and federal. Monies come from that. And it's for low-income families or people on what's called SSI. That's the Social Security Supplement income. I do want to mention, too, though, that because it does affect transitioning to Medicare does affect in a big way your ability to purchase a insurance plan, a qualified health insurance plan through Vermont Health Connect. At that point, when you're eligible for Medicare, you do not get offered any subsidies through Vermont Health Connect for insurance. So it's not a good idea not to take Medicare, but if you still wanted to buy an insurance plan through Health Connect, then you would have to pay the full price. And it's really important for people that aren't already collecting Social Security to call up Social Security or apply online for Medicare at least 3 months before their 65th birthday, because they want things to start on time. And there's other things that they, like supplement plans and Medicare D plans for prescriptions that they have to follow enrollment times for. And certainly I can process that with them.
So let me ask you a little current event here. Recently, last week, President Trump made an announcement, and he said that the federal government would stop making payments to support cost-sharing reduction, CSRs. Is that going to have an impact on the open enrollment process, on Vermont Health Connect? What can you just...
Well, Vermont Health Connect isn't planning that. I don't think it really will until, we have to see how it all shakes out for even the 2019 year. The information I received from Vermont Health Connect, of course, is the 2017 plans won't be affected at all. And 2018 plans should not be affected by that executive order. Any changes to any plan, whether it's cost or change in services that happen in Vermont, have to go through the Green Mountain Care Board approval process. until the board says otherwise, those 2018 options stay the same. I know that the Vermont Attorney General has joined with other states in filing a lawsuit to prevent the federal government's non-payment of the subsidy payments. And those are required by the Affordable Care Act. And if things do happen, the Green Mountain Care Board's going to work really close with the Vermont insurance companies and other stakeholders to lessen any impact that could be for Vermonters.
Great.
So right now it's important to, just focus on what's going to be the best plan for me.
Right. Well, the other thing in terms of best plan for me is getting to know you, because you're the resource advocate.
Yes.
So if someone wants to meet with you and get all this information, what kind of availability do you have? I mean, how do I do that?
Well, you would call me. I have my direct line that I can make appointments with, and I'm at 802-365-3770.
Okay, 802.
365-3770.
Okay.
And I'm available Monday through Thursday. I work 8 to 5. So my last appointment really for insurance type things would be at 4 o'clock. And generally you can call me for an appointment. I can probably get you in between a week. It rarely goes out to 2 weeks.
Right.
Sometimes it may take a couple of meetings to get the application done and a health plan picked. Or if you're already at the doctor's, you can stop at one of the receptionists and make an appointment. Really, just about anybody well, maybe not the doctors, but just about anybody at Grace Cottage can make an appointment with me.
Great, great, great. Now, when I come to see you, or if anyone comes to see you, is there something special they need to bring?
Yes, I need to ask people for a picture ID. Usually that's the Vermont driver's license, but if people have just moved to Vermont and they haven't done that yet, they haven't gotten their Vermont driver's license, I ask them to bring some sort of proof that they're a Vermont resident and they intend to stay in Vermont. And then to really get started, I'm going to need everyone's income resources. You can do that by payroll checks, even a letter from your employer stating how much you're getting and how many hours you're working, last year's taxes, if it's pretty much going to stay the same. I'll need that for everybody in the household. And a lot of times people forget to bring everyone's social security numbers. I really need that to get started as well.
Okay, well, I have that memorized. Now, is there a fee for any of this?
No.
No fee?
I'm part of the community health team, so I'm a free service.
Whoa.
Absolutely.
A resource with no fee. That is
Yes.
just fantastic.
Yes.
Jane, thank you so much for taking the time to be on the show.
Okay, thank you.
We'll be right back with Bill Monahan, a registered nurse and community outreach coordinator at Grace Cottage. Now, a lot of people don't know this, but November is American Diabetes Month. So here's a brief message from the American Diabetes Association. We'll be right back.
When I was first diagnosed in the small town that I was from, they thought it was type 2 diabetes. It turns out that I didn't have type 2, I had type 1, and that I was gonna have to be on insulin shots for the rest of my life. And I was dating my now husband, and I thought for sure he was gonna break up with me, and that, why would anybody want to be saddled with what I was now saddled with? But he has just been an amazing support system. He has encouraged me to advocate for myself as a patient. I have had doctors tell me that, pregnancy was a horrible idea and that I shouldn't do it, until I found one who said, we absolutely can do this. I am now the mother of a almost 4-year-old who is, in no other words, a miracle. I wanted a cure because I wanted to have kids. Now that I have a daughter, I just want to be there to see her grow up and to watch the life I created unfold. This is my miracle. This is diabetes.
Welcome back to Grace Cottage Hospital's Healthcare Matters, a monthly show that brings you timely information on health-related topics. Our guest is Bill Monahan, a registered nurse and community outreach coordinator at Grace Cottage. Welcome, Bill.
Thank you, Marty.
So we just heard about health insurance, and so once someone has health insurance, When should they use it? Should they use it, only when they're sick, only when they're hurt? When should you use your health insurance?
Good question. Well, of course, that's what the heart of health insurance is, when you're sick or injured. But there's a shift going on in primary care and more of a focus on preventative things and wellness tests, and that has become a primary focus in transitioning healthcare to create healthier communities and healthy individuals.
So a lot of people don't go to the doctor because they're afraid of the costs of going, but what about like annual wellness visits? Are they covered under most insurance plans?
They are, but it's always a good point to follow up on some of Jane's issues, to know your policy and know what it covers, and to know that sometimes when you go for annual exams or intermittent exams, that there might be tests ordered that might not be covered under your policy. So there might be co-pays or things you might be responsible for. Most policies have contact information with them, an 800 number. So those would be good to have available on the insurance provider's end to understand what is covered under your policy. And then and it's also one of the most important things I feel is to have your annual exams and your tests, because you're setting up a relationship with somebody who's going to get to know you over the years. And your primary care provider, be it a doctor or advanced practice practitioner, it's an important baseline for them to get to know you and to understand your general health. So they'll know triggers in their assessment of you, when things are changing or when interventions are needed.
So physicals are generally covered, but are there other preventative care measures or screenings that also can be covered?
Yes, there are mammograms for women and prostate PSAs for males. Also, there are other variety of tests that are covered under that particularly basic lab works and things like that.
And what about like flu shots and things like that?
Flu shots, I believe, are generally covered, and that's a good question. And I believe they're also covered under your plans.
Wow. Okay. So I should use my health insurance, and I can use it for preventative means. I can go to see my doctor annually, and a lot of these costs are included. But I should check first before I do that. Yes. Another thing that I see is there are these urgent care centers that are popping up, and I also read about that primary care doctors or practices are closing down. What's your feeling on that? Primary, again, we see these urgent care centers, and we hear about the primary care practices. What's going on, do you think, with all of that?
Well, it's an interesting question. Right now, there is a primary care doctor shortage, and we're trying to get things like that filled. As far as the urgent care centers go, in my experience, and I believe they can be helpful at some level. I was just had reviewed their charging system the other day, and we have one locally. And in their statement, they say that no bill will be more than $250 per visit, and that can include X-rays and labs and everything. So cost for the individual that doesn't have a plan, they only have a catastrophic plan, and so they get a lump or bump or a bruise or have a cough or a flu-type symptoms. It might be a good option for them rather than go to an emergency room when primary care is unavailable to them.
Interesting.
Yes.
All right. So, other thing I should have asked you in terms of the first question, registered nurse, right, and community coordinator. Right. What does a community coordinator do?
That's a good question. I have a couple of algorithms within my position at Grace Cottage, and one of them, and one of the primary functions is in primary care, the nurses and we have other services offered through primary care, behavioral health, nutrition and weight management, a diabetes educator, and all these things add up to being an extension of the primary care's toolbox. And our team is embedded in our primary care, which means a lot of times a physician or advanced care practitioner can literally walk down the hall and introduce us to someone that they feel needs some of our services. And that happens actually quite often. We also provide transportation services at Grace Cottage for people who can't meet their transportation needs. And we also once again have Jane Wheeler Services as our patient advocate, who's a very important part of our community health team.
So as the coordinator, I mean, so you're working with all these different folks under one roof.
Yes.
Wow, and you all talk amongst yourselves and
Yep.
provide all those services.
Yes, we do, and we have an excellent rapport with one another, and we do quite well as a community health team. And I think the future is part of that transition in primary care to wellness and health. The community health team is an integral part of that in the transition phase and long into the future.
And as a registered nurse, are you, how do you see your role? Are you enjoying this role?
Well, I'm having a blast.
I'm
having a blast. I've had a lot of challenges. I come from nearly 30 years of clinical background, and so this was a transition into community health for me, but I think it was a part of me, and I've enjoyed it very much and embraced the challenges. Another algorithm that I have in my job is as outreach, is I've started some programs in the community. One was the transportation program through the community health team. Another one was helping understanding some of the common denominators in health problems and in health, in high blood pressure, nutrition, and diabetes and things like that. So I've been active in all those areas too.
Well, I've been following you on the Grace Cottage Hospital website. There is a number of articles about you, whether it's tons of tomatoes or Veggie Van Gogh. You are the go-to guy. So, I think anyone who wants to know about Grace Cottage should go to their website. If you want to know more about contacting the community health team, there's plenty of information about that as well. Bill, thanks for being on the show.
Thanks for having me.
I want to thank our guests, Jane Wheeler and Bill Monahan, and a shout out to Roland Boyden, who's doing all the magic behind the camera. I also want to thank BCTV for helping us bring this show to you. If you have any questions, concerns, or even ideas for future shows, send them to info@gracecottage.org. That's info@gracecottage.org. I'm Marty Cohn. Thanks for watching.